Hello and a warm welcome to BBC World News. We're going to start in India, where the healthcare system is collapsing under the pressure of a massive second wave of coronavirus, with hospitals across the country full, with patients left untreated for hours and supplies of oxygen desperately inadequate. Well, doctors at a hospital in the Indian capital, Delhi, say that at least 25 critically ill coronavirus patients have died because of a shortage of oxygen. The hospital's medical director said that they expected supplies were delayed and arrived too late. Several hospitals in the capital have issued desperate calls for oxygen as patient numbers continue to swell. Well, for the third day in a row, India registered the world's highest ever daily rise in coronavirus infections. The latest figures show that more than 340,000 new cases and more than 2,600 deaths. Well, let's cross over to speak to Dr. Harjit Singh Bhatti, who works on the Covid-19 ward of Delhi's Manipal hospital. And we appreciate that this is an incredibly busy time for you, so we do appreciate your time. But just, Doctor, would you just explain to us what is happening on your wards?
There is lots of patient load, and we have to say sorry to many of the patients whom we are not able to admit. But we are seeing that many serious patients are arriving to hospitals, and unfortunately, because of the limited beds, because of the limited resources, we have to tell them that to find out somewhere else, and they just start crying. Literally crying and saying that we have searched for hospital in whole of Delhi, but we are not able to find any bed. How can we manage our patients? And they also have a pulse oximeters with them. They show us the saturation, that our patient saturation is 50%, 60%. Please, doctor, do something. But with all possible efforts, we are not able to manage all the patients, and we have to divert them to other hospitals or other facilities. And even sometimes they take our phone number with them, and they just manage their patient at home. They manage them with oxygen, even with injectables at home. And we are supervising, consulting, or means managing them at home also, in the wards also. So this is a very exhaustive time, and I have not seen this type of situation in my whole career. So this is very exhaustive time for as a health worker here.
It sounds absolutely relentless. And when it comes to your hospital, the Manipal hospital, is it the lack of beds, the lack of oxygen? Where's the crux point? Where's the breaking point for you?
No oxygen supplies are adequate in Manipal hospital till now, and whoever patient get admitted in the hospital, they are adequately treated. But the problem arises when we are not able to admit, because hospital have a limited capacity. So when we are not able to admit those patients, then only the problem arises. Otherwise, there is obviously whoever is admitted, they are till now they are getting sufficient amount of oxygen. But as we are seeing the media reports, and even the big hospitals in Delhi, even the government hospitals, they are saying that they are left with only few hours of oxygen. So these things scares us more, that if same situation arises in our hospital, then it will be a very difficult situation for us also.
And your superiors, your advisors, what are they saying? How are you being helped when it comes to this situation, which is obviously, as you've described it, it's relentless, it's exhausting for you and your teams?
Yeah, till now we are just trying to help as much people as we can. We are not thinking of sleep. We are not thinking about our duty hours. We are ready to give our 24 hours to the wards. And even if we are off duty, like today, if yesterday I did my 24-hour duty. Today I am at my home, but still since morning I am consulting people. I am supervising them for management of home. Even I visited one of the patient at home and tried to help them in whatever capacity I do. So whatever we as a healthcare worker are able to do, we are doing. Though there is no guidelines or instructions from the administration or from the superiors to what to do or not to do. But this point of time, every healthcare worker in whatever capacity, they are just into the healthcare services, and they are neither thinking of their sleep, they are not thinking of their personal life, nothing, just into the services of people.
Dr. Harjit Singh Bhatti, thank you so much for giving us an insight into what you are doing, what you are facing, to you and your team at Delhi's Manipal Hospital. We wish you the best of luck. Thank you so much.